Some good news in the fight against the coronavirus. There are some promising new developments in the global race for a coronavirus vaccine. Early results from a trial at Oxford University suggest the experimental vaccine is both safe and effective. For more on this, let's turn to Dr. Howard Forman. He is a professor at Yale University and a practicing physician. Dr. Forman, thanks for being with us here today.
Thanks for having me.
So this trial included more than 1,000 people. The results suggest that the vaccine induces an immune response. Walk us through exactly what scientists have learned.
So, in vaccine development and through the trials, what we're looking for is safety and efficacy. So we want to make sure that it doesn't harm the people that get it, and we want to see that it actually delivers on the promise. Right now, the questions that have been asked are, does it induce an immune reaction that might protect you from COVID? We know if this particular vaccine that they're testing, that it seems to work in macaque, non-human primates. We know that when given to them in a sufficient dose, and then when they're challenged with SARS-CoV-2, the virus that causes the COVID, that those animals are protected from getting infected. And that's what we want to see in humans. Right now, we've done the first step just to see that it's safe in these humans. And by the way, it's 18 to 55-year-old healthy individuals as opposed to the population that we're most concerned about at this point. But that's an incredibly important first step.
So what is the next step in this research?
So now we move into randomized controlled trials to see, does it protect you from getting the virus? Are those individuals who now have antibodies, does that mean that they're protected from getting the virus? Does it mean that they're protected from transmitting the virus? Those types of questions. It also means that we'll start to ask the questions of, is it safe in 65-year-olds and 75-year-olds? Is it safe in people that have hypertension? Right now, we've only tested it in younger and healthy people. Now we're moving into that next phase of seeing, does it actually work in a more normal environment?
When it first comes out, this vaccine, when it does, how do you convince people to take it? Because a lot of people might say, well, I'm not going to be one of the first ones.
Right. So we have a lot of challenges. We have challenges about communications to making sure the public understands why this is so important, why they have an important role to play, not just in protecting themselves, but in their fellow citizens and their family members, members of the community. And we also have an important role to play in making sure that the vaccine gets to the people who are most vulnerable, making sure that we're able to get it out there widely into all communities and not just into the communities that are best served by our healthcare system today. There's a lot of work to be done. It's not a simple matter. We're talking about 330 million people, and we want to be able to rapidly deploy this.
Thank you. Dr. Howard Forman from Yale University. We appreciate your insight tonight.
Thank you.